And I'm really excited to be a part of this seminar series of LSS Learning Hubs. And I'm really thankful to the organizers for letting me speak from Pakistan over here. Um, Today, I will be discussing something about artificial intelligence and how it is related to personalized healthcare and specifically to dietary assessment. Dr. Suzanne has already introduced me and rightly said that I am these days leading the Department of Nutrition and Dietetics at School of Health Sciences, UMT Lahore. As well as I assume a volunteer position as a continuous nutrition education coordinator at Pakistan Nutrition and Dietetics Society of Lahore chapter. And you can see from the topic that we will be discussing two major things over here. That is how artificial intelligence and the precision nutrition works. Precision nutrition is also something of a newer sort. You can say that it is a newer field of nutrition that is getting popular these days. So starting off with the what AI can do, let's imagine something that if your phone is seeing whatever you are eating, and it can identify the calories, the micronutrients, all the things that you are eating, and it can recommend you or tell you that you are not eating enough of so and so nutrients. This sounds futuristic, but because of AI, this is all that we are going towards. Actually, nutrition is known for as a leading one of the leading causes of many non-communicable diseases, especially in the world, and we've always struggled with accurately determining how what a person is taking in. That data is really important to correctly calculate, because if we have correct data of the dietary intake, we can make the connections with the health outcomes, the disease outcomes that it can lead to. So tracking what people are eating is really necessary in order to find out the connections between the dietary intake and the health. The problem is that there are many a series of, you can say, errors or biases that can arise in dietary assessment. And I would like to share and I would like to share thing with you in order to find out that how the problems in the current dietary assessment can lead to various biases and they can lead to you can say that a whole rippling effect of how they can lead to the wrong classification of people, and in the disease groups as well as in the exposure groups, and it can misclassify the people, as well as it can lead to wrong diagnosis of the diseases as well. I have a paper on this, the problems in the current dietary assessment, and I've shared a link on at the bottom. If anyone is interested in reading that out, they can do so. What happens is that if we ask someone what did they eat last night or in the past 24 hours, that's 24-hour recall is one of the basic dietary assessment tools that we use. So a person might be able to recall correctly what they have eaten, but the problem comes in when we ask them, how much have you eaten? The precision of the portion size is really difficult to understand. So the real-time data is must be accurate, and it must be individualized. For example, we can now see that there are certain general recommendations made in the world, and some of the people, because of their this is a topic of research in nutrigenomics as well, that because of the genetic makeup of someone, they may not benefit from general recommendations. This is a time for leading us towards the precision nutrition or the personalized, individualized nutrition. This means that the data that a person is going to benefit from comes from within his own diet, along with how that his or her body is responding to that diet, or the environmental factors or the lifestyle factors, and how what recommendations should be made individually and uniquely for that person or that individual. That is the concept of precision nutrition. For precision nutrition, it becomes even more necessary that the dietary assessment is made correctly, because the data that we are using for the future recommendations for that person come from the person, and if the data is not correct, then it can lead to hurdles in the future prediction of the diseases or monitoring of the disease as well. So AI is revolutionizing the field of nutrition and dietary assessment in several of the ways. Here are some examples. You can see from here that I've listed down three major AI technologies that are being used in healthcare as well. The first one is machine learning, and you can say that it is the brain of the computer, and it learns from it. The data reinforces certain patterns, and then those patterns are used to predict the future. So there are categories in machine learning. There are further you can say the research in the computer science, but overall machine learning is the predictions made from the data-driven predictions, you can say. And the computer vision, it's the eye of the computer, and you can upload a picture of certain foods, and it can automatically disintegrate all the nutrients, the ingredients that come with it. The natural language processing, this is the same technology that we use in translations of from one language to another. The textual data is extracted from figures or images. The you can say that voice notes are converted into text. The natural language processing is being used in the dietary assessment as well. We can get some insights into each of these. Machine learning or deep learning, you can say that there are basically two types of data that are used to drive the predictions. The first one is programmed into the computer, that if a person is eating this much amount of a certain nutrient, then it will lead to certain type of disease. It can predict the disease risks if a person enters the data in an app or something. And the deep learning, you can say that it automates, it automatically connects different analysis, even if it is not programmed. It can predict the future through experiential learning, and it's a very advanced technology. You can say that different patterns of food intake, if a person is entering the data about what they're eating, and what their lifestyle is, what their physical activity level is, what their stress factors are, the whole thing is being entered, and then their health risks are being predicted before they actually get the disease. So it's very important for people to have a early screening in terms of prevention and public health. So it's a very important science that is being used to develop the apps related and web-based systems to related to the you can say the dietary assessment. Computer vision or the image recognition of the food, this is especially important for one thing is that it introduces ease. It's easier to upload a photo of something rather than logging in the details of whatever you are eating. For example, if we say to someone that you have to keep a log of whatever you are eating or food diary for say 7 days, then it will be burdensome for the people. So it's really easy that if we have programmed data for the images of different foods or recipes, and if a person uploads that image, it automatically connects both the things and then estimates the nutrients that the person has consumed. And this not only the type of food but also the portion size, because as I've previously highlighted it, the more important factor is that we are unable to recall for say how many cups of certain things I have eaten. For example, my cup definition of cup might be different from another person, and for a researcher or for a clinical dietitian, the definition of a cup is a standard cup that contains so and so milliliters or grams of food. So the portion size estimation is one of the things that computer vision is helping us in. So we can simply recognize, it can recognize the image of the food, and it can detect what type of food and how much amount of food that a person has eaten. It is also especially important for the combination of meals, combination of foods that a person eat in a meal. For example, if a person eats three things, then they might not be able to recall all of the things afterwards. So an image might be very important for them, or easier to upload. The third thing, the natural language processing, that has the voice activated food journals, etc. We can use the computer vision and the NLP together in order to enhance the ability of computer to recognize the food. For example, if a person has eaten something that is that he's not sure that the computer might not be able to recognize, so they may upload a voice note concerning its recipe or the ingredients, and the amount of the ingredients, etc. And it can convert along with the image. It can use the voice note or the textual data to do the analysis of the nutrients, the nutrient analysis from the grocery lists or the written texts, social media, from the textual analysis from even restaurant menus. That is the thing that we are leading towards in the conversational AI, the chatbots. This is the thing that can help us in the correct dietary assessment, and to reduce the biases such as the recall or misinterpretation, misreporting, or because a person is being observed, or because a person has been asked to recall the data, he might hide something. So if we are using the AI technologies, these biases can be reduced. So these are some of the points that I extracted from a paper, and they have highlighted all these technologies, how are they related to nutrition, and how they can improve the smart and personalized nutrition. The personalized nutrition, again, is how a person can have a unique recommendations for themselves. The dietary assessment tools can be improved through artificial intelligence, the food recognition and tracking, not only for the sake of individual, but also for the tracking of food can be done. If a person logs in through an app, then his health record can be accessed by the clinical dietitian, or if that person is a participant in certain type of research, then the researcher can access that data. You can say that it is a very live data that a person is logging in, so it can help in tracking the diet of a person. And predictive modeling of certain type of diseases, that is early screening of the disease, early diagnosis, and monitoring of the diseases. If a person already has certain disease, then they can use these models to reduce the risks or complications of those diseases. For example, if we are adding certain type of we have logged in, and we have said that we have already consumed so and so amount of you can say sugar, and the person is diabetic, then the smartwatch or any app that contains the person's data can recommend him or her that what he should be eating in the party that he has to go at the dinner time. So the recommendations are personalized, and they are really predictive if we are using the artificial intelligence. Additionally, the integration with the wearables, the like I've said, that smartwatch or the fitness trackers, etc., the monitors, the integration of AI into those enhances our chances of precision nutrition. The predictive and nutrition, as I have said, that what you should be eating next is already based upon the data that you have entered in. So it can lead to better choices in the next meal. Gamified health nudges. This is also a very researched upon area these days, and you can say that especially for the children and adolescents, there are certain rewards or points that they can gain from eating certain foods, and even bonuses or discounts, etc. So these can lead to healthier food choices. These are used as interventions or nutrition education materials as an incentive for the education or the better health outcomes. So and lastly, all of this data is if it is recorded electronically in the form of an web-based system or app-based system, etc., that data can and then be utilized for bigger purposes, because if we are entering manual data, that there is no record of that in the world. So the data can be used for disease prevention in the public health settings, as well as it can lead to clinical insights as well. So the data set, if used as ethically, can have many positive impacts in the future of nutrition and dietetics. However, there are certain ethical challenges. There are biases in some AI models. For example, whatever we are feeding in the AI, it gets its experiences from those things. If the research is being made on westernized diets, then for say South Asian dishes might not be present in the it might not be able to recognize those. So the underlying thing is that we need to have a global view in training the AI models in order to reduce the bias. So my doctoral thesis was research was related to this, and in which the data set of South Asian cuisines was introduced into a web-based dietary assessment tool. So the biases can be reduced if we involve all the people from all the cultures because it's a multicultural world. So we can have global groups in which the AI can be trained in order to help us in the field in this field, as well as the data privacy is one of the big issue, because many people whatever they are writing down in the apps, or so there can be concerns about the leakage of the data or misuse of the data. So there are guidelines on the ethical considerations of artificial intelligence related data sets as well. So the equity in access, there, in order to utilize the technology of artificial intelligence, the internet access and the computer access, they are the basics. So if a certain area in the world does not have access to that, then it can lead to unequal distributions, as well as biases in AI models. Lastly, is the trust issues. We might not be trusting whatever AI is recommending. Up till now, there are certain researches in this field that whether artificial intelligence based systems can lead to diagnosis which are at par with what the health professionals can do. So they are comparing the accuracy of data that can be generated using AI, but the research is not conclusive in this regard. So we must be embracing all these technologies in order to improve whatever data we are putting in, the dietary assessment data in this particular situation. Otherwise, AI is being used in the field of nutrition and in a wide array of fields. So we can say that for the healthcare professionals, it is empowering them. It can empower them if it is used properly. And we must raise awareness regarding this matter, that we must use these technologies in order to make better use of the data sets in the future. So this is the whole thing that I wanted to share with you. And I'm really thankful for letting me speak. And if anyone has any questions or critiques or anything, they are very welcome to